Hey, hello everyone, and welcome to our webinar titled Snakebite Envenoming the Global Health Research Landscape. Before we begin, I'd like to mention that this webinar is being simultaneously translated into French and Spanish. So if you move to the next slide, it'll just show you how to switch languages. So if you'd like to switch languages, please use the toolbar at the bottom of your screen, find the icon that looks like a globe, click on it, and select the language of your choice. I'll just give everyone a moment to do so. Now you should be hearing the language that you have selected, with thanks to our live interpreters. I'll provide some housekeeping rules before we begin. Next slide, please. So first, this webinar is being recorded and will be shared on the Global Health Network's website in a few weeks. Because we have so many participants, we encourage using the chat function to introduce yourself and the Q&A function to ask questions. Again, use the chat function to introduce yourself and the Q&A function to ask questions related to the presentations. Which brings us to our agenda. Next slide, please. So to note, this webinar follows a survey that was sent out through the Global Health Network some months ago. We were using that survey to try and understand who is working on snake bites and where. There was an overwhelmingly positive response. So we asked the respondents if they'd like to come together and provide a brief overview of their work. You'll see a list of some of the snake and snakebite experts on the slide here. We saw merit in connecting these individuals around the world on this topic, and we thought we'd open up to you, the audience, so you can see what's happening too. Next slide, please. And you showed a great level of interest in snake bites. Here's a map that shows how many people registered for today's webinar and where they are coming from. It also shows why people are here. It's clear that we have a lot of clinicians who treat snake bites, and we have a lot of general snakebite enthusiasts. So welcome to everybody. We'll jump right in and get started with the first of two webinars happening in this series. First, we're going to hear from Robert Ofwete, who is a technical advisor for neglected tropical diseases at AMREF Health Africa. He will be giving a presentation about mathematical modeling of snake bites in Turkana County and outcomes given access to treatment. So I'll go ahead and hand it over to Robert. Thank you.
Thank you. I'll start off. My name is Robert Ofwete, and I'll be doing a presentation on mathematical modeling of snakebite in Turkana County and outcome given access to treatment. Next slide. Next slide, please. So snakebite is a public health concern of the poor tropical population. It majorly affects the impoverished populations, and it results when a venomous snake introduces lethal toxins to the victims. This can be through bite or spit in the eyes. And of the estimated 5 million annual incidences, around 1.8 victims end up envenomed. And of these, it is estimated that 400,000 morbidities are effectuated and around 94,000 are case fatalities. And as you can see, I pulled this map from a Gutierrez paper on snakebite envenoming from 2017. And it shows the spatial distribution of snakebite burden per county, and Africa comes second to Asia continent. And next slide. To the right is a map of Kenya's burden on snakebite. Is a spatial distribution from data reported from monthly cases from health facilities in the DHIS. That is the district health information system. And as you can see, Turkana County is the one with the deepest color, having the highest burden of snakebite in Kenya. And that is why the site was purposely selected for this study. Next slide. So why is mathematical modeling for snakebite? Among the problems that are actually lying rather tied to snakebite, there's limited burden in conjunction with the fact that surveys are mainly conducted at the health facility level, and majority of victims tend not to seek hospital treatment, but rather traditional or no treatment at all. And there's therefore limited information on the interplay between snake and human factors. And this model will help us bring the dynamics of snake and human factors and how they lead up to snakebite incidents. Next slide. So the research question for this presentation is how does snake and human factors affect the dynamics of snakebite envenomation in the study area of choice, that is Turkana County, and does seeking hospital care following snakebite affect the outcome of snakebite? Next. The broad objective, so the study develops a mathematical model that integrates snake and human factors to investigate the dynamics of snakebite incidents and outcomes in Turkana County. And specifically, we formulate an SIRS compartmental deterministic model that captures the dynamic of snakebite, and we determine the effect of varying model parameters to changes in the snakebite incidences. And at the end of it, we apply the model to determine the level of hospital seeking that reduces snakebite induced deaths associated with hospital seeking behavior. Next slide. So mining for parameters for the model borrowed largely from the PRISM approach for systematic literature review. And we had a total of 18 papers from both the journal searches and references within the paper that qualified for the full text review. Next slide. And these are some of the parameter values that we got. Total population, assuming a completely susceptible naive population. So we took the population of Turkana County as the population of interest and susceptible at the beginning of the simulation period. And the simulation time steps were in days, and the life expectancy, so the birth and the death rate were assumed to be equal because these are assume a fixed population. And because that deterministic, I applied average values from the parameter value source from literature. And the beta here represents the probability of bite, which performs part of the force of infection. And we have proportion seeking hospital treatment represented by theta. Next slide. And then recovery from hospital, we have it there represented by psi. And then by phi, the recovery from predictable compartment. And then we have the gamma, representing the overall recovery rate, and then you have the disease-induced rates. Next slide. So what are the model assumptions? The population of snake is constant for the simulation period, and there's no immigration or immigration of snakes into and out of snake population. All species of snake exhibit similar behavior during human-snake interaction, and the human susceptible population is fixed. That is birth equals the death rate, and all the susceptible individuals are equally susceptible through the simulation period. In the envenomed individuals become susceptible again, that is SIRS, going back to the susceptible to recovery. There are no bites in snakebite victims undergoing treatment. And finally, all cases of snakebite, including multiple bites on an individual, are from unique snakes. Next slide. So this is the compartment diagram, largely classified into the susceptible, infected, and the recovery. And the susceptible transition to the eye. Next slide. I want to see the equations, to follow through the equations. Next slide. Yeah, sorry, the first equation. Yeah, the transition from S to I is defined by those who are coming in due to birth and those who are leaving due to background deaths, or those who are leaving due to bites, and those who are coming in due to the recoveries. And then the transition from S to I is also defined by interaction with the snake population, defined by a logistic growth curve, which is represented down below. Next question. The next one again. So the infected can either choose to go to the hospital H compartment or not to go to the hospital. And here we got a rate that represents rate of seeking hospital care, that is theta, and a complement of it, not seeking hospital care, and one can still die based on these compartments based on disease-induced deaths, that is SBS, snakebite envenoming, or natural deaths, or transition to the recovery. We can move to the next slide. Yeah, next slide. Yeah, next. Okay, so that represents the system of grouping equations. And we have, we also calculate the effect of hospital seeking on snakebite case fatality, represented by those going to the hospital over those not going to the hospital. And the study also calculated incidence density and confidence interval. Next slide. From here, you can see that plotting, because one of the data sources was KHIS data, that is the Kenya Health Information System, DHIS in Kenya. So plotting the DHIS data, the one in black at the top shows, and plotting the non-response rate data, the data adjusted with the non-response rate shows about 40% non-reporting to the facility level. And when we adjusted the data and tried to fit our logistic growth, we see a mismatch in terms of the highest level and the mark that represents a specific value. So then the next point is now to try and match and improve the fitness of this model, the adjusted reported data, and that's what we see in the next slide. Trying to adjust now here, I applied maximum likelihood estimation, and ideally for each simulated data point, you want the maximum likelihood estimate value given the observed data point that is adjusted, and applying trajectory matching using MLE, then this is the improved fitness of the model. And then when we put the data now into the SIRS compartmental model, we see that then we have the model converging at around 10.120 with a total of 3,319 cases, representing 368 cases per 100,000 person years. Next slide. So in terms of model validation, if you compare the value from our model and the adjusted reported data, you see that there's no difference as shown by the cross-cutting confidence interval values. And also comparing with previous studies like the one from Abdullah in Nigeria, 2021, you see that the model trajectory in terms of the model curve is similar. And you also engage the county teams, so then we get the restoration from the study area if our model speaks to the truth. Next slide. So effect of varying parameter values, I'll showcase the force of infection and recovery rate. So basically doubling the force of infection, which is expected double the incidence of snakebite. So that means then that exposure values, if they're doubled, the model shows that the interaction, or rather the interaction was direct in terms of doubling of the incidence, and halving of that value or halving of the exposure values led to reducing the incidence by half. Next slide. Next slide. So for the disease-induced rate, it was an inverse proportion. It was an inverse proportion where doubling the disease-induced death rate led to halving of the cases and a delay in convergence of the model, and probably this could be explained by reduced number of people going back to the facility because it's a deterministic. All the parameter values are held constant over the simulation period. Next slide. So effect of hospital-seeking behavior, we did not simulate the effect of early access to antivenom or antivenom at all, but just going to the hospital. And it shows actually over the simulation period that 32% of deaths were averted, anything between 20 to 46%, and on average 1.8 deaths were averted with every 10% increase in hospital-seeking behavior. Next slide. So discussion, we see that because KHIS or the DHIS captures data from health facility, it runs a risk of underestimation because it doesn't capture data from the community level. And the model shows a clear difference of burden of snakebite in Turkana compared to other countries. And the incidence rate compared to that from adjusted reported data seems to communicate to each other. And it is estimated, the model estimated that 9% of snakebite victims seeking hospital care following snakebite, which is lower than that has been reported in Burkina Faso, which was 56%. Next slide. Yeah, I'll go to recommendations because of time. Next slide. So what conclusions and recommendations are we getting from our model and our studies that the burden of snakebite envenomation in Turkana County is grossly underestimated? Around 50% of the values in terms of an estimation. And the model shows that seeking hospital care after snakebite is important in improving outcome of snakebite envenomation. And therefore, early treatment with antivenom should be emphasized. And finally, for recommendation, we recommend integration of snakebite into the health system, particularly in Kenya for the community health workers or other promoters, integrating snakebite into their training module and strengthening referral pathways to improve on hospital seeking behavior, and probably including snakebite into the social health insurance benefits package to encourage hospital seeking. Next slide. Yeah, the limitations was that this was a deterministic model and only gives average scenario and the failure to capture morbidities and effect of antivenom. and the model does not show seasonality due to snakebite. Thank you.
Thank you so much, Robert, for a very interesting presentation. Next up, we will hear from Kingford Chimfwembe, who is a research coordinator at the Neglected Tropical Diseases Focal Point person at Treso University in Zambia. So Kingford today will be talking about assessing the current status of snakebite capacity in Chongwe district, Zambia. So I'll pass it over to you, Kingford. Thank you.
Thank you so much. Could you please do the next slide for me? Next slide, please. All right. So very valuable lessons from the previous speaker that has actually highlighted most of the challenges that we have regarding snake bites in Africa and in Zambia. So snake bites seems to be a new field, and it's important that now we have interest in this field so that we can find the challenges that we have. Most because most of the cases regarding snakes are not reported, and from African perspective, people would rather go to the traditional doctor than actually going to the hospital. But it is worth noting that we do have about 81,238,000 deaths that occur as a result of snakes, and actually most of these occur in the African setup. Next slide, please. Okay, so when it comes to our scenario in Zambia, so currently there is some data that is being collected by Ministry of Health in the Health Management Information System, and in one of the regions in Zambia, there were about 9,384 cases of snakes in about between 2016 as well as 2019. Of which, according to the data that was reported, we had about 10 fatalities. Now, when it comes to antivenom, this is most likely similar in African settings. You realize that antivenom is not usually very present. Okay, so a similar study that was done showed that the availability was between 7.5 to 10%, and yet most of the people were actually reporting snake bites in the country. Next slide, please. Okay, so what is the problem? What is it that we are trying to achieve? So the current level of snake bites is not known, and this is not only to Zambia but also in other settings. And the reason why this is the case mostly is actually because most of the cases are not reported. All right, and what that simply implies then is that if the burden of the problem is not known, then it becomes very, very difficult for government, for example, to find any research that may require maybe the development of antivenom. So most of these snake bites are also handled by the health workers, and it's also not very clear whether maybe even there's a component in the training sector of health workers that looks at managing these snake bites. So from the reason, or due to the fact that rather that most of these people rather go to traditional doctors than seeking healthcare from established health institutions, it actually means then that we have a challenge in as far as where knowledge, attitudes, and practices are concerned regarding snake bites in the country. And arising from this, then it is important that we need to build research capacity in snake bites in the country. Next slide, please. We're going to look at the current status of snake bites in the country and also try to look at the capacities that actually exist. How are we going to look at that? We'll look at that first by reviewing the snake bites data that we have. This is from the hospital records. Also trying to look at what data is being captured in the health management information systems. Then from there, we'll try to see if we have the antivenom in the district, and then try to see whether the staff have been trained in handling snake bites, and also conduct a CAP study on the residents in the affected area regarding snake bites. So these are some of the objectives that we look at. The next slide, please. All right, so how do we intend to achieve this? Probably we'll use a descriptive cross-section study. Our variables, of course, subject to change depending on how we can be advised on the prevalence of snake bites, the availability of antivenom, and where this antivenom is coming from, whether it is coming from authentic sources or not. We also try to look at the staff training in the management of snake bites, and also the knowledge, attitudes, as well as practices of residents in snake bites. Next slide, please. Okay, so what kind of data are we going to collect? Like I've said, we collect snake bites data by looking at hospital records, but also when you go into the communities, we ask whether some of the people had reported any snake bites. And then on the availability of the antivenom, we'll look at the pharmacies in the hospitals and check whether indeed the antivenoms are there or not. And then also try to go on the retail market and see the presence of the antivenom as well as the cost. Okay, then also try to look at whether the health workers have been trained in managing snake bites or not. And then we'll collect data on snake bite outbreaking behavior. Next slide, please. All right. So what do we expect to find from this study? We actually know the current status of snake bites in Chongwe. Chongwe is one of the towns in Zambia. And depending on how well we go with this, we want to extend this study to the rest of the country. Okay, also look at the availability of antivenom, and then we are hoping that the training needs of healthcare workers will be known, and then the knowledge, attitudes, as well as practices of the residents regarding snake bites will actually be known. So this is work in progress, which we intend to do in Zambia, and we brought it here to the experts so that probably we can receive feedback and see how best we can go. So this is where I end. Thank you very much.
Thank you so much, Kingford, for that very interesting presentation.
Thank you.
Yeah, thank you. Next up, we will hear from Beth Tippett Barr, who is the director of Nyanja Health Research Institute in Malawi. So Beth will discuss plans for a multi-country snakebite survey using existing health and demographic surveillance systems. So go ahead, Beth. Thank you.
Thank you very much. I will actually keep my video off just because of bandwidth problems.
Sounds good.
Great. So just a key point from the title here, this is a plan for a multi-country survey. We do not yet have funding to do this. So if anybody has leads on that, we would love to hear from you. Next slide. And next slide. Okay. So we know that the awareness of snakebite envenomation is increasing globally. We know that WHO now has a roadmap to reduce incidence by half through prevention and treatment access. But we also know that baseline data on incidence and outcomes across countries is scanty and unreliable. And of course, most of the countries who are heavily affected by snakebite usually don't have the funding to implement national programs. What limited donor funding does exist tends to focus on therapeutics and community education. And so really what we need is cost-efficient baseline and monitoring data, data being the keyword, so that this can inform program planning, it can guide policymakers, and can measure progress towards the 2030 goal, starting with a baseline and then progress. Next slide. So the primary and secondary study objectives are first to provide high-quality baseline data on the incidence or burden and the outcomes of snakebite in communities. This will inform governments of the actual burden of snakebite compared to just what's reported from health facilities. So this is looking at a population denominator. It generates a starting point against which to measure progress towards the 2030 goal of 50% reduction. And it allows you to disseminate country-level data on which to base rational arguments for increasing funding both within countries and internationally. It'll provide data on community norms for snakebite treatment. We hear anecdotally of many different things that are done when people are bitten before they present at a health center and after. So this would provide much more information on that. And then also comparing how the population level data differs from routinely reported government data, because of course, within most of our countries, the government health facilities report every quarter on all of the visits that they've had to the various outpatient departments and admissions. And snakebite are one of those things that's reported. But this doesn't actually give us any idea what's going on in the community for people who either never show up at the health facilities or who die before they get there. And so then we want to know basically, just to compare, again, if we can access the government data, we can then compare how much the population survey data varies from the government health facilities in the same catchment areas. And we can use this comparison to then extrapolate to other areas in each country and potentially have a better understanding of what national incidence and outcomes are. Next slide. So how do we do a gold standard multi-country research study without spending millions of dollars in every single country? And just to sort of give you a baseline, if for a large survey, national survey, in Southern or Eastern Africa, in my experience, will cost upwards of $5 million per country. And these days, often a lot more than that. So how do we do this in a way that a donor might consider being somewhat affordable or at least cost efficient? And one of the ways that we can do this is to maximize the availability of existing population-based health and demographic surveillance systems that are across the continents already. So if you're not familiar with what an HDSS is, this is where you have a defined catchment area, usually between 25,000 and 350,000 people living in that area. And then every 3 or 4 times a year, you literally go house to house collecting basic demographics and vitals on the entire population. So you're looking at 20 to 45 minutes per visit, and you're collecting everything on births, deaths, pregnancies, pregnancy outcomes, vaccinations, and hospitalizations. That would be your baseline normally. And then you could nest additional studies on top of that. So you could add a module on snakebite so that, say, when they go out in the Q3 of a given year, they're now asking all of the snakebite questions. And so this basically, you've got your infrastructure in place already to do the survey. You are now just adding questions to that survey. You also then need to maximize your existing contacts in the HDSS networks and HDSS sites. There are networks of sites that coordinate and talk to each other, which we're already working with 17 of those sites, and we're engaged with 2 of the large networks that exist, or one that did exist and one that's soon to exist. And then a third piece of this puzzle is engaging the ministries of health of the countries that this is being done in to secure routine health facility service data. This is through their district health information system, or often it's the DHIS2. And this would be a no-cost data that we could compare the reported facility burden with what we're finding from the HDSSs in the community and looking within the same catchment areas. Next slide. So these are the countries in Africa with known HDSS sites, known to me, I should say. Let me qualify that. There are 48 sites across these 17 countries. The sample size would give us, if everybody participated, this would be just over 4 million people, which is 0.5% of the entire continent's population. And there are HDSSs also in India, Bangladesh, Pakistan, and other countries. Next slide. So this would be a cross-sectional survey nested in the HDSS, which then readily provides the potential to conduct periodic follow-ups. We would establish a multidisciplinary study advisory group, schedule a phone call, and send out a request for expressions of interest from the HDSS sites. There would have to be, of course, incentives for site participation, including their basic costs. And there are additional costs for training and time of people in the field. And then usually a very popular thing is capacity building for data analysis and dissemination. So writing scientific papers, giving presentations, establishing a study coordination group, coordinating protocol clearance across the multiple sites, and then, of course, coordinating the data collection, cleaning, and submission, and then moving into data analysis and dissemination, both within countries and globally. Next slide. So what we really want to see is when you do one analysis, you want to make the most of every opportunity to disseminate the data. This will give you the greatest impact. So not just writing a paper, not just giving a presentation, but really looking across all opportunities from policy briefs to local technical working groups, and even taking information back to the communities that you've collected your data in. And of course, this also requires knowing how to tailor the message to these different groups. And then we can also do site capacity building for data dissemination, so a virtual writing workshop, and then one-on-one mentoring for any of those scientific deliverables. Next slide. The cost and the timeline. It's not cheap, but it's not expensive by multi-country survey standards. So our core cost for running this over 2 years would be about $1 million, and then it would be an estimated 72,000 per site that participates, with 20 to 57,000 also needed if we wanted to disseminate high quality, locally translated educational materials. And so this is the process. This would be a 2-year process. And then if you look at the window for the data collection, really there's like 6 to 9 months where if you wanted to repeat the survey in future, you could repeat that 6 to 9 months and get the data that you need. Next slide. So in summary, collecting multi-country gold standard population-based data on snakebite incidents and outcomes is feasible and affordable. We are positioned and ready to do this. And we are we really believe that the multi-country data combined with intentional data dissemination and capacity building can drastically increase the visibility of snakebite envenomation, both nationally and globally in all of our countries. And again, we are actively seeking funding for this study. If you're interested in funding us or collaborating with us on this effort, we would also love to hear from you. Thank you very much.
Thank you so much, Beth. That was really interesting. I know sometimes these multi-country studies, it's kind of dismal how much funding it takes, but it's good to see it end on a positive note. So next we'll hear from Hiral Naik, who's the Africa Program Manager at Save the Snakes. She will talk about perspectives of snake behavior to combat snakebite. So take it away, Hiral. Thank you.
Thanks for that, Aashna. Yeah, so I am the Africa Program Manager at Save the Snakes, which is an American-based nonprofit organization, and we work internationally. I'm also a PhD student currently focusing on snakebite in South Africa. And I'm the chair of the Snakebite Community Engagement Network, which some of you may have already been a part of. If you are working at the community level and want to be a part of the network, please do get in touch with me. So of course, my presentation breaks things up a little bit because I'll be focusing on the animal in question, snakes. So as a herpetologist, I'm very passionate about snakes. And it's very clear for me and many others who love snakes that snakes play a very important role in our ecosystem. But of course, there are many others that have a very ingrained fear of snakes. And this fear of snakes has led to the killing of both non-venomous and venomous snakes. And of course, when this interaction occurs between people and venomous snakes, it obviously leads to a snake bite. So with my work with Save the Snakes, it was very clear that we needed to focus on mitigating snake bite by mitigating human-snake conflict. And so we've set up a program in South Africa, joining forces with Hoedspruit Reptile Center, which is an education and conservation zoo. And so our program focuses on educating people in the rural communities here, within the schools, within the communities, working with healthcare professionals, and training up local community members. At the Hoedspruit Reptile Center, we've also got an anti-venom bank, which is made available to people should they need it in the case of a bite. This is also made very clear that we are not doctors ourselves, and the aim is to go to a hospital to get the care. And so our snake education and community awareness program has been running for the last 3 years. And we started off in 2021 when COVID was just, still among us. And so instead of focusing on the rural communities, we had to zone in a little bit more. And what we learned is that knowledge about snakes is actually quite rare, and really, most people are rarely informed about snakes in general. And so teaching people about the techniques that we use when it comes to snake handling, don't touch a snake with your bare hands. It's important to show that snakes belong in our environment, and of course they only feel threatened because we are perceived as a threat. And so over the last few years, we've been able to go into different schools and communities and showcase the biology of snakes. And I say this specifically because it's very important that when we discuss snakebite, that people know that it's not just an animal that we want to neglect. It's not an animal that we want to kill. It is an animal that has every right to be in the environment as much as we do and every other animal does. And what we've actually found is that this allows people to really learn a lot more about the animals in question. And this also allows them to ask many questions that we often don't encourage people to do. And so they start to learn a lot more about the animals that they're actually living with. We also use non-venomous snakes as interaction animals, and we found this as to be a very useful tool in being able to change the perceptions that people have of snakes. We also do demonstrations with venomous animals. And this is very important because it's important to be able to show that, for example, in the bottom left corner, the snouted cobra, like other cobras, would because they are afraid and they are feeling threatened. When they are provided with the opportunity to slither away or move away, that is exactly what they will do. And so we've also been able to run surveys to be able to monitor and evaluate the perception of the learners before we implemented our conservation efforts and education efforts. And when we revisited the schools afterwards, we were able to see that there was a 29% decrease in the fear of snakes. Now, this is obviously a baseline kind of perspective that we have. But getting this kind of data from community projects is really useful research in being able to actually combat snake bites. We also work, as I mentioned, with healthcare professionals. And as much as healthcare professionals often deal with snake bites when it comes to symptoms, it's very important, it's equally as important for them to know about the snakes that are living in their area. Or snakes that are the leading snakes that are biting people within that country, within that area, whatever it is. And so this has been very successful as well, because we are also building very valuable relationships with the healthcare professionals. And so we're learning from them and they are learning from us. And so anytime there's a snake that needs to be ID'd, we are always available to help them out. And this, again, is really useful data that we are actually able to collect. And so, as I mentioned, I'm a PhD student, and specifically, I'm looking at the behavioral ecology of medically important snakes in South Africa. What I have found is obviously that there are large data gaps when it comes to learning what the actual number of bites are, but also the behavior of medically important snakes. As much as we have an idea of many of these charismatic snakes globally, we know very little about their behavior. And this is absolutely crucial if we want to put the puzzle pieces together. Through this work, we've also been able to be a part of the National Snakebite Advisory Group in South Africa. And we have been able to set up a national snakebite database. And through this database, we're not only capturing data on the bites and where they occur, but we're also trying to gain information on how these bites are occurring and where on the body these bites are occurring. And this is a really, really useful tool in being able to gain an understanding of exactly where the hotspots are, and being able to create effective prevention measures. The distribution, of course, learning about the distribution of snakes is very important. The WHO obviously has quite an important project at the moment, focusing on trying to learn a lot more about the distribution of snakes within different regions, and how this might be changing over time. But of course, it's also useful to be able to tie this in, correlate this information with where people currently are living, where people are being bitten, where the hospitals are, and how this ties in together. And all of this is data that's very useful for all of us in being able to try and mitigate the number of snake bites as much as possible. As I mentioned, we have established a snakebite community engagement network. And this too allows us to get an understanding of people that are currently working on the ground, and to learn about what they are experiencing. And then also to be able to implement research within these communities. So if it's surveys that we need to be able to run to gain a lot more information from these communities that are hard hit with snakebite, then we have community members available to be able to do that. And this is why it's important that we work together to share resources, and obviously with the ultimate goal of encouraging a lot more harmonious living relationships between people and snakes. If we are able to do this with many of the other animal species we have around, this can certainly be done with snakes. And of course, this means that it does require many of us to be able to work with people from other disciplines, and to be able to put all this information together, and to be then to be able to create effective prevention measures. Thank you very much.
Thank you so much, Hiral, for that great presentation. We can see how important community engagement is in learning more about snakes and the effect of snake bites. So next up, we have Moses listed. So Moses here is a PhD student from the University of Hamburg, working with the research group for snakebite envenoming at the Bernhard Nocht Institute for Tropical Medicine. Moses is also affiliated with Partners in Health in Malawi, and he will be discussing knowledge of healthcare workers and experiences of traditional healers and snakebite management in rural Malawi. So go for it, Moses.
Thank you so much. So I'll be presenting knowledge of healthcare workers and experience of traditional healers in snakebite management in rural Malawi. This is a project that we started way back in 2021 with support from the Royal Society of Tropical Medicine and Hygiene, under a small grant. And I had collaborated with the other institute, for example, Ben Gurion University of the Negev in Israel, and the government of Malawi, as well as Wellcome Trust. But currently I am affiliated to research group Snake Envenoming, as has already been said. And I also work for Partners in Health in Malawi. All has been said as to why we are here and why we are listening to this webinar, mostly on snakebite, and statistics have been provided by previous speakers, also including to where people are seeking care in case they get snakebite. So my focus will be mostly on Malawi. So according to the information that we have around or over 66 types of snakes, of which 11 are classified as medically relevant, and most of these are of the group Elapidae, that is cobras and mambas. So there's a picture of Mozambican spitting cobra, and then also vipers, for example, puff adder. And our country, the majority of the population are smallholder farmers, all the way from the northern part till the southern part. So just to give you also a geographical location of our country, we are found in Southern Africa, and we are bordered by Tanzania to the north, Mozambique to the south, as well as Zambia to the west. But if you go on Google Scholar or any literature search engine, PubMed and others, you will find that there is limited information regarding snakebite in the country. And the publications that you're going to get, pretty much the scientific publications that you get, I would say, are the ones that we have started, that we published from Neno district, and one that was published by Beth that just spoke some minutes ago. However, it is also recommended that snakebite antivenom or snake antivenom is the standard treatment for snakebite. However, its availability is more problematic in the country. So I'm sharing one of the articles that were published in 2018, where a government hospital had run short of snake antivenom, and they had to seek the help of the traditional healer. Recently, the government have made strides in making sure that they have snakebite as one of health priority agendas. So they incorporated it into a national health research agenda from 2023 to 2030, which means that we are on track and we are working on things that seem to be a priority to the government as well. And so what did we do? We conducted a cross-section assessment in terms of healthcare workers' knowledge regarding identification, management, and treatment of snakebite. And then we also had a chat with the traditional healers to understand the experiences as well as the practices on snakebite treatment and prevention in rural district of Neno. And so Neno is a district that is found in the southwest part of the country. It has a population of around 150,000, where over 70% of the population live below poverty line. And over 94% are smallholder farmers, and less than 10% of the households have electricity, and they have around 15 health care facilities that provide primary and secondary care services to the residents. Whereas if you require a referral, that means you have to go to Blantyre, which is approximately a 3-hour journey. So on healthcare providers, as I said earlier, we interviewed 105 healthcare providers that are providing the services in the district, and this is published in PROS Neglected Tropical Diseases. And it just included a QR code scanner for easy access. So the median age was around 80 years. 42% of clinicians said they had ever prescribed antivenom, whilst the 26% of the nurses had administered antivenom. However, we noted that dosing was a problem. One clinician said, I usually don't write the actual dose, I just like give snake antivenom, the dosing is done in the ward. Which simply means that there is room for improvement. We also looked at number of cases that we presented to the hospital between 2018 to 2021. So there were 182 cases that presented to the hospital, of which 52% were hospitalized and 2 people lost their life. In terms of the traditional healers, we also published this in PROS Neglected Tropical Diseases, and I have included also a QR code for easy access where you can read through. So what we did was to go to the traditional healers and ask about the treatment that they provide to the snakebite victim. So we interviewed 16 traditional healers using qualitative methods, where we assessed in terms of knowledge what kind of care they provide, if there are all treatment that they also get in terms of prevention as well as relationship with the healthcare provider. So what we found was that, as always, traditional healers claimed good knowledge, despite that this knowledge was tested. So these were claims that are knowledgeable of the snakes are found in the area, and that they offer a good continuum of care from diagnosis through to follow up, and that pretty much the communities prefer them because they offer free services, or either they ask them to pay whenever they are okay. And they also claim that they have somehow what we term as a prophylaxis or vaccine, that if they get some incisions over it and in your body, then it acts as a snake repellent, which cannot be validated using these kind of methods, but these were claims that were done by traditional healers. So the picture there shows one of the concoctions that were being utilized to do that. And that there was a complex relationship between them and the healthcare provider. So in one setup, they said that they are engaged. In another setting, they said that it might be very difficult to that. What does this imply in summary and on snakebite? So we found that there was knowledge gap, and what we had done or recommended was to do a training of healthcare providers on snakebite management. And with Bernhard Knockett Institute for Tropical Medicine, we had applied for some funding. And just recently, we have done that training, which I would say I'm happy because we identified the gap and we're able to act to ensure that they receive training that can help to also support the treatment that they would offer to snakebite victims. And then we also think that there is need of integrating traditional healers in snakebite management. We all know that snakes exist in two forms: venomous snakes and non-venomous snakes. Likely that if you're bitten by non-venomous snakes, you get okay anyway. So when you go to a traditional healer, probably we should engage them that they should identify signs that would aid them to refer the patient quickly to the hospital. And above all, there is need of more funding, as other speakers have already said, that we have to do research, not just research, but quality research that can inform policy and programming toward the WHO 2030 agenda. And ensure also that we have availability of antivenom, and not just availability of antivenom, but quality antivenom that would be useful to our snakes, useful to our patients, and that they build trust also. So in short, handling snakebite is a multi-sectorial approach that needs involvement of everyone. From previous speakers, we've noted on how community members can be engaged. We think traditional healers should also be engaged. And then village chiefs, spiritual leaders, community health workers, and facility health care providers should be engaged. Otherwise, thank you so much. I have provided a QR code to our team, fantastic team. My supervisor, Beno, and Deborah, and York, and all other that we've working together. Also from Partners in Health, they have been so supporting to ensure that we have this project done. Otherwise, thank you so much.
Thank you so much, Moses, for such a great presentation. Next up, we're going to hear from our colleague, Eduardo. Eduardo Boza, who will be talking to us about the Central American Initiative for Snakes. Just to remind everybody, this presentation is in Spanish, so for those of you who would like to listen to it in English or French, please ensure that you've selected the correct channel from the interpretation icon in the toolbar below. All right, with that, thank you. Take it away, Eduardo.
Muchas gracias a Aashna. Muchas gracias, Luis.
Thank you very much, Aashna, Luis. So greetings to everyone. Thank you for being here today. So I'm going to turn off my video so my broadcast can be a bit better. So the main purpose of this presentation is to offer a brief overview, a general overview about the initiative, the Central American Initiative about snakes, which includes this initiative, and we're going to talk about the philosophy, how it's made up, and how it works.
La Iniciativa Centroamericana sobre Serpientes es un grupo muy diverso de
So
personas y entidades
Central
que abordan
American
temas en
Initiative
relación a
for
serpientes,
Snakes is a diverse group of people and bodies that engage with different topics related to snakes. And these can be summarized in research, so maybe field research or lab research. Also, this works linked with the community. Also, we have medical treatment, and also we have training.
Esta iniciativa la hemos ido tejiendo bajo la guía
So
de
this
ideales
initiative
como
is something that
el
we have
dinero,
been working together
pasión,
with a
la voluntad,
guide of
la
ideals such
disciplina,
as,
la
passion, effort,
independencia, es
goodwill,
decir, hemos cuidado
discipline,
mucho nuestra
independence.
autonomía,
So
pero
we
eso no
have really,
significa que trabajemos aislados.
we have
Hemos
protected
procurado
our
muchos
autonomy, but it doesn't
vínculos
mean that we work
con
in an
diversas
isolated manner.
entidades
We
en
have
Centroamérica.
searched for
Otro ideal es la
connections and
procura de un
partnerships
trabajo
with
de
several
calidad,
agencies
sin
in
apuros
Central America.
perjudiciales
Also, we
y
are
con
trying
un
to
gusto
search
por la
for
esmerada labor.
work that has high quality
Además, la buena
without
divulgación
rushing, and
de lo
always
trabajado.
trying to find a good level of work. And also, we
Ahora
want to
deseo contarles
disseminate
muy brevemente
whatever
cómo ha sido
whatever
la
we
creación
find in
de
our
este proyecto.
research. So now I'm going
En
to
el
briefly talk about
2016,
how this
un
project was
grupo de
created.
miembros del
So
proyecto
in
Excel,
2016,
que es una
a
iniciativa
group of members
centroamericana
of
sobre
the
ciencia,
Excel project,
arte y
which is a
filosofía,
Central American
realizaron una
initiative about
pasantía
science,
de
art, and
investigación en
philosophy,
Costa Rica
they did an
y comenzaron a
internship, a
formar
research
las
internship in Costa
primeras
Rica.
ideas
So they
respecto a la
started to
investigación de
form
serpientes en
the
Honduras,
first
sobre
ideas
todo
related to
respecto a ecología
investigation of
de
snakes in
serpientes
Honduras,
y en
especially
relación a sus
regarding
venenos.
the ecology
A
of the
partir
snakes
de
and also
enero del
regarding the
2016,
venom.
este grupo, con
So
mucha
starting
motivación,
in January of 2016,
siguió madurando
this
las ideas
group with a lot
y
of
se dio a la
motivation,
tarea
they
de buscar
continued
un
to work on these
liofilizador.
ideas, and
Liofilizador es un aparato
they
químico
assumed
que
this
liofiliza, es
task of
decir,
finding
que
the
extrae el agua de las muestras de veneno
lyophilizer. So this
y,
is
y
basically
las
a
deja
device that
a modo de
extracts
polvo,
water
y este
from
es un
the
excelente
samples
método para
of the
preservar los venenos,
venom,
de
and it
modo
basically
que
creates a
permite
pulp. So this is an excellent way to
con mucha confianza
preserve venom.
investigaciones
So this
respecto a los
allows us
venenos de
to
serpientes. En
investigate
2016 y
with reliability,
2017, el
to
grupo
investigate and to
estuvo
research on
trabajando
the
en
snake's venom. So in
acondicionar el
2016,
liofilizador
2017, this
y
group
aprender sobre
started
su
to
uso.
work to
Aquí quiero
condition
recalcar
this
que en muchos
lyophilizer
países
and to
de las
learn.
regiones tropicales, la
So,
investigación es más difícil
and I want to highlight
que
here that in
en
many
países
countries of the tropical region, research
más
is more
desarrollados, digamos,
difficult
en investigación
than
científica
in these
o
more developed
en cuanto a equipos,
countries
¿verdad?
regarding
Entonces,
scientific research
siento
or as
mucho
far as
agrado de
devices as well.
compartir con tantas
So
personas aquí
I am
de
very happy
África,
to
porque
share
así
with
como
so many of you
Centroamérica,
from
perdón, así
Africa,
como
because
África,
like Central
Centroamérica
America,
también tiene alta
or
diversidad de
like
especies,
Africa,
poca
rather,
investigación
Central America also has a
y
high
muchas
diversity of
dificultades,
species, very
pero
little
es
research,
fundamental la
and a
motivación
lot of
que se tenga.
difficulties. But it's
Durante el
crucial, what is
2018
crucial is
y
our
hasta hoy,
motivation.
el grupo
So
ha
throughout
trabajado en explorar
2018
más
and
acciones de
up to this moment,
investigación
the group
y
has
algo
worked to
fundamental
explore more
en
research actions,
indagar
and
con
something
diversos
crucial
entes
is
que
is
trabajen
to
respecto a serpientes
continue
para
to work with
establecer
different
enlaces.
agencies that
Esto es
work
muy parecido a lo que estaba comentando
with
Beth
snakes to
de
establish
establecer
partnerships and this or
iniciativas
links. This is very similar to
multinacionales.
what
Esto lo
Beth
hemos
mentioned, that
venido
we need to
trabajando
establish
aquí en
multinational
Centroamérica.
initiatives. And this is something that we
También
have been
del
doing as well in
2019 a
Central
hoy
America.
hemos estado
In Central
trabajando en
America.
la
So also
estructuración y
from
ejecución
2019 till today,
de una
we have been
estrategia
working in the
de
structuring
trabajo
and
que
execution of
incluye, por
this
ejemplo,
a strategy,
coloquios,
a work strategy
el
that includes,
establecimiento
for
de un
instance,
sistema de
you know,
pasantías
workshops, courses, a system of internships, and also the planning of new research. And from 2020 till today, what this began in Honduras, we started to expand this to all of Central America in such a way that the Honduran initiative about snakes has already transformed itself in a Central American initiative about snakes with basically we have worked in an organized way with a lot of discipline, but we have been making the most of the situation, so it hasn't been thoroughly planned ahead of time. And in 2019, we issued a document about our Honduran initiative about snakes, and we highlight, the fostering of WHO to develop national and regional strategies that may manage this topic, the snake bite issue. Also, we have a brief overview about snakes that are recorded in Honduras, and also about the magnitude of human poisoning. And also it highlights the integration that we have performed with different agencies in Honduras to address these topics about snakes. And as I said before, we have already done this in all of Central America. And also in this document, we mention the crucial, the fundamental values, which are integrity, multidisciplinarity, and a good organization and coordination. And these are our main pillars to sustain these types of projects. We know that funding is important, but we don't highlight it as a pillar. We don't believe it's fundamental. So I think what is most important is a good coordination and establishment of partnerships between people and entities. So the Snake Central America initiative is supported, or it stands in these pillars, which are supported by the philosophy that we have in the Ishel project and the Honduran initiative about snakes. So as Lamarck said, without science on its own doesn't make sense. We need to have a philosophy. So science without philosophy doesn't make sense. So we believe that the philosophy is very important, and this is made up by a comprehensive view, also with a coordination, appropriate coordination, and also motivation that we hope that will grow. This needs to be, cross-discipline, and also we need to form and keep links between these 8 entities, bodies, and also we have a link with a community, and also an academic view and a public health view, never a commercial view. Also the fostering of scientific research and also enthusiasm for learning. So in this initiative, we have a body of ideas with a purpose, with the goal of establishing a strategy, an interaction strategy in Central America. And amongst these ideas, we have the following: to develop a comprehensive philosophy. We want to work with a lot of effort. We want to keep, or we also want to increase the motivation of the members of the group. We want to take care of our synergies. That's very important, because a network is not only a group of bodies, right? So these interactions are very important. So we need to really take care of them, because the synergies between those that participate need to be appropriate. Also, the project always needs to be in construction. We need to continue training ourselves, and the project should not reach a commercial view or vision, but we should have economic sustainability. And finally, we need to bring these things together, right? Research and the dissemination of this research, and the training of the members of the group, and interaction with all the community. So it has to be a fusion of all these components. So this strategy has allowed us to work with organizations in all of Central America, almost all the countries of Central America. I'm not going to mention all of them, but I'm going to give you some examples. So we have institutions that work with immunology, we have some that work with parasitology, we also have some that we work with zoos, also health departments, also some organizations that work with chemical components. We also have medical sciences organizations, veterinary organizations. We also have PAHO, also that is involved. We have biology organizations in all of these different countries. We also have biochemistry organizations, for instance. And amongst the activities of our initiative, we have the fostering of research. We have activities in our communities. We have monthly internal conversations, and we also have chats for a broader audience. We also have, basically a virtual photographic base, a bibliographic base. We also have coordination between different venom bases, which are freeze-dried, and also coordination of different organizations. And the idea is to make the most of these efforts. So, and to finish, I want to share some examples of activities that we have done. So we created a freeze-dried venom base, and this has made it possible to have other types of research. So this venom bank has been done with our extractions on site or from the lab. So, and we have about 500 samples in this basis venom bank. So we have a collection that is for learning and one for research, and it includes venom from 9 different species. So with this venom, we have been working to analyze the effect of snake venom and how it reacts with bacteria. And we have tried to find the minimum inhibitory concentration. And another opportunity, we can share some results of this research. And something that is very important to wrap up is that we have included also this topic in different institutions and different environments. For example, in university classes and internships and research projects, and also in work that we have done with the communities. So we believe this is a great strategy to have a multinational initiative. I believe that in for Beth's project, this would be also applicable to incorporate this topic in different universities. And here we have the contact details of several members from our initiative. Thank you very much for your attention. Thank you to the organizers.
That was such a great presentation. I hope everyone learned a lot from it. We can move to the Q&A then. I'll just ask Louis to pin all the speakers' videos. If bandwidth allows speakers, you can turn your videos on. If not, no worries. You can just leave your audio on. We've had some really interesting questions, as I mentioned in the Q&A, and perhaps I can go ahead and combine a couple of them. I'll ask, this might be most applicable to folks who have worked either with clinical data or community level data. So people like Kingford, Beth, Moses, Nuhu, if you're around. But anyone can feel free to comment on this. So we had a couple of questions related to the fact that snake bites are complicated in themselves and that they lead to long-term implications for snake bite victims, such as psychological implications, mental health, but also reduced capacity to work due to medical complications, and that in turn turns into sort of socioeconomic implications as well for individuals who have been bitten by snakes, but also their communities. So it's complicated in that sense, but it's also complicated in the sense that it doesn't just affect one person. It could affect entire communities and health systems, depending on how expensive the complications are to treat. So kind of in your opinion, is this something that is a gap? Is there a gap in knowledge related to to complications like those that are just not just dealing with the snake bite itself, but something more long term, and something that affects not just the individual, but the people around them. Is there a gap in data related to that in your experience, or is this something that you're starting to see people pay more attention to? So I guess I'll kind of open the floor, and then anyone who wishes to comment on that, feel free to jump in. It's kind of a loaded question. I understand that. I see Moses chuckling. Do you have any input?
Yeah, so maybe I can start. I think there is still room for more literature to come on that, because I think the studies that I've come across, there are not many studies that have looked at the aftermath of a snake bite. And how that affects the long term in terms of daily adjusted life years of a person, for example, or apply a health economics aspect to ensure like we quantify also the effect, the aftermath of a snake bite. So I think there is still more room that we should also think about those. And less of the studies that have also looked at PTSD, and other kind of trauma that usually exists. I think the focus has been on the actual treatment itself and not necessarily the aftermath of that. My colleagues can add as well.
Thank you so much. Does anyone else have anything to add?
Yes, I can add. Yeah, so due to the fact that this field is basically more or less like you, I think, like Moses had said, there's a lot that we need to do. So maybe from the experts, probably one of the studies that we can start looking into is what Moses has actually proposed. Try to see if we can do studies and then model those studies and then see what we can do.
That's a great point. I see Nuhu has also just joined us. As far as I remember, Nuhu, your team is also looking at sort of the economic impact of snake bites. Did you want to add to the conversation related to that? Oh, perhaps there's bandwidth issues. I see, Eduardo, you also have your hand up. Feel free to jump in.
In Spanish, please. Thank you very much. Well, based on the statement of the WHO as snake biting as a health problem, there has been giving more attention to the subject, but in the tropical regions, which is where we have this accidents, this disease, I'm sorry, this is very rare. We don't have much research on snake bites and ecological conditions in which they happen and the social conditions. And I like Hiral's presentation because to study the behaviors of the snakes is something that is very rare. And as what Moses also mentioned, I mean, the consequences and haven't been treated either. So we work with that. Usually when we're working with snakes, even though our activity is quite specific, but when we work with snakes, we are dealing with a theme that is not very much dealt with exception of the Butantan Institute, for example. Cloromiro Picaro in Costa Rica, but in other regions, we face a panorama with very little research indeed, and we have to work on that.
Thank you. And yeah, thank you, interpreters. I was trying to follow along in English alongside, so that was really helpful. I see that Nuhu is online. Nuhu, if it's okay with you, would you mind presenting in the next session? I see we only have a few minutes left, but we can put your presentation first in the next week, if that sounds okay to you. Just so we end on time. Oh. Okay, fantastic. Thank you. And perhaps with the last few minutes, I can just expand on what everyone has said and lead into sort of a second question related to the multifaceted sort of ways to address snake bites. Somebody had pointed out it involves improved access to healthcare services, better access to anti-venom, public education campaigns. I know Hiral had talked about the incredible impact that something like an education campaign can have. So I guess if anyone wishes to comment on sort of in their experience, how a multifaceted approach has helped them in their research, I'll open the floor now.
I can go.
Sure.
And this is really tailored to what we do, because I've gained so much knowledge, specifically from case reports coming in from being or engaging with healthcare professionals. And what we've learned is that, no snake bite is the same. Everything is different. We're still learning so much more about the venom of different snakes as well. And so communication is really important. And that means partnerships, whether it's institutions like universities partnering with local NGOs, and between both the science and medical fields, as well as the social aspects as well.
Fantastic, thank you. I see Robert's also got his hand up. Go ahead, Robert. Does anybody else want to add to that? I think it's clear that snakebite is something that can't be addressed by research alone, but as Hiral said, needs lots of partners to work together, from NGOs to academics to clinicians. And that's partly why we had this webinar here today, to sort of encourage collaboration and showcase what folks in different places are doing. Yes, go ahead, Moses.
Sure. So I just wanted to say that it is also influenced by, I would say, cultural norms that we have. So for example, in my country, Malawi, for example, there are some myths and beliefs that exist. In case I've been bitten by a snake, maybe it was sent by my uncle, and therefore I would not go to the hospital. I would rather go to the traditional healer, because this, at the hospital, they would not treat the aspect that this snake was sent by my uncle. So we also need to create, as we go for the community intervention, we need also to create into how we can integrate these kind of norms and how we can change and also influence in terms of health-seeking behavior. So I wanted just to add that component to say that it's supposed to need to be multi-sectorial. We also need to be considerate of the cultural norms in the society in order for us to make a good advancement. Thanks.
Yeah, that's a really good point. I see Robert's back. Robert, would you like to comment?
Yeah, sorry for that. I had a technical. Yeah, just to echo what my fellow colleagues are saying, ideally, snakebite is a One Health issue. It's a solution to many disciplines and not just one. And traditional, a lot of studies are focused on the clinical component. But then again, because of data limitation and resource limitation, this has mainly been based at the facility level. But at the community level, we also have a big problem. Why? Because as my colleagues are saying, people tend not to seek hospital care. Yet there's so much data at the community level, even data to do with the mobilities. So when I was doing my study, I found it hard to get parameters on mobilities in terms of amputations, in terms of disfigurement. So the solution to this probably means that the solution is embedded within the health systems component. So if you look at supply chain anti-venom, and that narrows even to readiness, even if they are available, are healthcare workers equipped with the skills of administering anti-venom with regards to the dosage. The data component, and we are looking at integrating snake bite with other diseases, so that then we can be able to mainstream some of these interventions. Thank you.
Thank you. And I see we only have 1 minute left. I saw, Eduardo, you had your hand up. Did you have something quick to add? Okay, cool. That sounds great. No, thank you so much, Robert. Since we only have 1 minute left, I'll just go ahead And wrap things up. And just to summarize, thank you everyone who had presented. Thank you so much to the interpreters for your job in live interpreting this in French and Spanish. Thank you to the participants who have joined today. Today, the intention was to provide a quick snapshot of all the different sorts of research and community initiatives happening in the snakebite world around the world. So we really thank you for joining us today. And we will have a second session next Tuesday, same time, same link. So do please join us for that to hear from anyone you have missed today and several others who will be presenting. So thank you again, and we'll see you at the same place, same link next week. Thank you all.